We're here with a couple of NewGait users on the clinician side, and we also have Kathy Ruprecht, who is one of our NewGait lead clinicians. And so I will let Kathy and Jozie give the audience a little introduction on who you guys are, what you guys do, and how long you guys have been clinicians.
I'm Kathy Tooman. I'm a graduate of the University of Michigan, and we both work in a outpatient private practice clinic in Ludington, Michigan. I've been working over 30 years, and my specializations are probably manual therapy and analysis of motion. And I also work at the local gymnastics center, so that's a real prime interest of mine.
I'm Jozie Weiler. I graduated from University of Puget Sound out in Washington State. I've been practicing, with Kathy at the same clinic for a year in August. So I'm a new graduate, so I guess I'm specialized in generalization, but I really enjoy working with athletes, and I have a passion for oncology, so I kind of want to play with that in the future too.
So I have been waiting all day for this conversation because I know when we first met down at the Michigan Therapy Association conference, we had the NewGait there on display, and you two had come through, and both of you had tried it on. And the reactions to your having worn it were really exciting to me. So if you would give us your thoughts on when you saw it, what you thought about it, what it felt like for you to start, I'd appreciate that.
Well, at first I was like, oh, I don't know what this is, but yeah, we'll try it. Why not? It's, new things, new fun. And so he strapped me all in, and then we walked down a ways, and Kathy was like, this Kathy was like, whoa, she's walking way better. I didn't know I was walking wrong in the first place. I actually felt like I had more rotation, more movement. It felt easier and more free to move, I guess. And I took it off, and it kind of stayed with me for a little while, and then eventually it kind of wore off. But we've played with it in the clinic too, and demonstrating for our other colleagues here about how to strap it in and all that stuff. And I did I think it was a single leg lateral step down, and I've had knee pain for, I don't know, a long time now, and I actually could do that without pain. That's even more intriguing to be like, okay, this actually does something. I don't know what yet, but we played with it, and firsthand I can experience how it can help movement.
And Kathy, when you had worn it too after you had seen it, you had said something about maybe wondering how it might help with your movement and comfort. So if you could tell us about that experience and your thoughts on it.
I've had a chronic recurring hip pain since I was 29. I actually have an instability in the left hip, so no matter what I do, I cannot get it stronger, I cannot be pain-free. We put the gizmo on me, and much to my surprise, I felt like I was loading in my left leg. I hadn't been aware that I don't walk with my left leg, that it wasn't connected, and I had a sense of, whoa, I have two legs here. The decrease in chronic pain that I have in my hip and my SI joint went away after just, again, that little trial, and it lasted for 10 days. We brought it home and had so much fun with it. We're kind of thrilled that there's not a lot of research. We're kind of glad that we're the people helping to provide the data and coming up with the protocols. So now we're glad to be part of this. When we first took it home for the trial offer, I actually called a lot of patients that I had had in the past or currently that I thought it might help. And I just said, we've got this new toy, I want you to try it. And every single one of them, when I put it on, felt dramatic change. One person did not. And I did videos before and after, and then they came back the next time, their gait pattern had changed 360. And they didn't even feel it happening, it happened anyway. That was cool. And then one person I know is totally unstable. I don't think she has any proprioceptive in any of her joints. She put it on and she literally started to cry because she said, now I feel my body. And she didn't want to take it off. And I think down the road we will actually probably just order her some for home. She feels absolutely high in it. But the real best one, okay, and I've got 2 case studies that I sent to the research person in Marquette on these 2 clients. Both of them I have known since they were in early elementary school, and now they're seniors in high school. Both of them had no functional neurological ability to push off their feet. The one was a gymnast. So through the years, we've been able to retrain her to use her body above because she can't move her ankles. She had faulty range of motion and the idea of to jump even when she was 10. She couldn't figure it out. The other gal was a runner who I've also seen off and on since she was a young girl. And this kid had the most horrible posture too. Her head's forward, she's rounded like this. No matter what we did, we couldn't change it. Both of those girls, 6 months later now, are jumping as high as they've ever jumped in their life. They've had to retrain their pole vaulting techniques and they're running because they are so fast and they're pushing off so high. Miraculous. 30 days we tried all these people and we had positive results on everybody. So we bought the sucker and now we use it clinically.
Thinking about what you know about movement, what you know about the neuroscience of movement and maybe even pain, what do you think is the mechanism whereby this might be giving people the sensation that they're experiencing?
We're trying to work on a theory for that, but all of us know that it's adding more proprioceptive or compression through the joints. Muscles move in functional patterns. They don't move alone. We know that from earliest development, we have to have a core established before we can use our extremities. Unless you have head control, trunk control, you can't bring your hands to your mouth. And we also know if one part of the body is injured, the whole body gets screwed up. And the other thing we know, and we fought with as physical therapists, is that movement is not cognitive. You cannot think yourself to move. And although we're all incredibly good therapists, finally when working with our athletes or movement retraining, we find ourselves saying, shift your weight like this, do like this. And these intelligent athletes with intelligent bodies try to do it. They try to think how to change their running. So as soon as they go out into their sport or life, they can't do it. It just doesn't get wired. When you're getting all of this compression, all this proprioceptive feedback into your joints, something else is happening too. And I think maybe what's happening is that we are giving the environment for the neuromuscular system to reboot itself internally. And we're ending all that external cortical confusion that we're throwing in. So the body has a chance to go, oh yeah, I get this. I think that may be what we find is going on.
The movement pattern restoration. It's like the antidote for the movement gone astray, hey? So I agree with what you ladies are thinking. That sounds absolutely perfect. And if there are any listeners to this interview coming on that have any access to move this research forward in some other way, please contact us because we certainly want to know more about what's happening here because there's obviously something happening. Describe, if you could, your comfort with first starting to use it on people. A lot of times, again, clinicians will say, it looks too complicated, I don't know what to hook up, therefore then I'm not confident and I don't want to touch it. So how did you guys grasp that?
Me, for years, and her at her young age, tend to be very creative and experimental with our treatment anyway. I can't think of the last time I gave somebody 3 repetitions of this or that. They always go home giggling because I give them to do very strange things. So to go one step further to this was not a stretch.
Any recommendations for us on things that you'd like for us to play with as we continue to work with the device?
Our colleagues, she asked me what I thought about having a shoulder pain patient try it and posture and see what just kind of happens. Well, I was like, well, why not? Let's just try it anyways. Who knows? It's not necessarily for shoulders and posture and all that. It's more for the lower extremity, but what the heck? Why not? So we tried it and this lady loved it. She's like, I feel taller. I don't feel so round. She's really enjoyed it and she wants to keep using it and coming back. And we're like, well, there comes a point where we can't keep you just because you want to keep using this because you have no pain anymore.
We have a friend who 6'8", and he actually had what I thought was stroke-like symptoms. He couldn't get in to see a doctor, so I virtual appointed him. I said, there's this thing called NewGait that we work with. Then he ordered the NewGait just for the leg that was so weak. He retrained himself to walk with his wife, and no medical experience, nothing, just through me virtualing him in a matter of 3 weeks.
I mean, I've got some dramatic things happening with folks all the time. People not needing pain medication, people walking in a manner they haven't done in years. So it really is an exciting tool.
Retraining our athletes and their techniques, it's mind-blowing.
Yeah.
Because once they've been hardwired into a certain technique, it's hard to work through to break through that. But the NewGait does. kind of, like I said, it reboots them and they can learn. They can learn whole new techniques.
Our colleague had a young kid, I think he's like 15, and he had several knee dislocations, and so they ended up doing a revision surgery to his pretty much entire system, and he was so afraid to walk that stiff-legged, limping, he was terrified, which as he should be. This is the third time he had dislocated his knee, and he finally got this massive surgery, and the NewGait helped him not be so fearful of movement. He's still using it, and now he's walking so much better. And we've also used it on a chronic stroke patient too, and you see him walking around all the time, and it's great to see that.
I really want to use it on is the gymnastics, because that group as a population have usually, the majority of them have no sense of where their joints are in space, none. And they have to, so they develop good technique. And you can spend hour after hour after hour trying to place your hands on them to show them how to feel, because they don't know what you mean. So you have to keep doing it. And then you have to keep spotting them. So it's labor intensive and frustrating for the gymnasts and the coaches and the parents. So what I was thinking we could do is the NewGait setup on them so that we can get the flex knees so they don't hyperextend them, and keep their thoracic spines back and their cores in, to giving the feedback that they don't get. They do not have that feedback in their joints. So I'm very excited to try it. I think it's a huge population to make a big difference.
Well, we certainly appreciate your enthusiasm and your ability to use this as creatively as you are. I know it's very exciting for the clients, and it's very exciting for you as staff, and we really appreciate your sharing this with us
Thank
today.
you guys
Thank you for developing it.
Yeah, it's been really fun, and we found a lot of usefulness out of it, and our patients really do enjoy it.